Hi, this is Dr. Antolak from theGentleDentist.com in Shelby Township, Michigan. 586-247-3500 is our phone number. One thing that we just got through with our Christmas, and between Christmas and New Year's of 2012, and we're in the year 2013, and one thing that we did see a lot of were college students coming back and having actually their wisdom teeth removed. We are a general dental practice, but because of my experience of the last 25 years of doing oral surgery, we have a lot of experience doing wisdom teeth, third molar extractions. Whether it's more complex or even simple extractions, we can do that. Because I have been going to Haiti also for the last 11 years, I have a lot of experience with doing extractions there without the use of a lot of the instrumentation that we have here. So, but with that being said, it is important if you are young, probably in your late teens to early 20s, to really seriously have your wisdom teeth, have that examined and contemplate having those extracted. I have a story, a neighbor of mine who was only 16 years old. She had wisdom teeth removed, and I couldn't do it because it got to the point where the roots were so well developed at 16 years old that it was right next to where the nerve is, and I had serious concerns that she was going to have numbing. Well, thank God she didn't after they were removed by an oral surgeon, a specialist, to do that. But the thing about it is that she was 16 years old. We think of wisdom teeth coming in when you're 20s. I think that used to be, but it seems like these days that kids are developing much more rapidly and sooner and maturing much quicker than they were in the past. And so now the time frame, what used to seem in the past as being in the 20s, now I'm seeing it into the late teens. And in fact, the dentist that she was going to was saying, oh, well, you have wisdom teeth, but we'll just keep an eye on it. And by the time we took a panoramic x-ray that revealed everything, her roots were completely developed, but the teeth were impacted in her jaw. In fact, I believe it's so important that the day after Christmas, my daughter, who is 11 years old, with the suggestions from an orthodontist that we refer to, that we not only remove 4 of her bicuspid teeth, but we also remove her wisdom teeth on the bottom, which were all encased in bone still. Well, needless to say, the day after Christmas and the day after that, she was a little bit swollen, but the good news is that we could take care of that before the roots developed so much where it was going to encroach upon the nerves. You know, anytime wisdom teeth are extracted, there's always a potential of having numbness in the lip because the nerve lies down right next to where that is, where the roots form. So if we can take care of that before the roots are completely formed, the roots, as they're developed, they're not calcified, they're not hardened, so they're a soft, kind of a thick gelatin kind of mass, and that can be removed without encroaching upon where the nerve is. So this is something that might seem kind of new and being a little bit aggressive, but my belief is that if they're not taken care of right away, they will potentially give you problems down the road, especially if they're impacted or kind of poking through the gums a little bit. When they're poking through the gums, you can actually get infections because the bacteria and food and debris gets stuck underneath the gums there and can create these infections. And in my opinion, it's better to have that removed preventatively than to wait until you have a significant problem. So if you'd like to get this assessed, you can go to our website, which is theGentleDentist.com, or you can visit our website at that, or you can give us a call at 586-247-3500. Thank you.